In strong opposition to the budget-busting legislation that fails to create one new job and returns our health decisions to insurance companies rather than doctors. Repealing the health reform law would be a big mistake. Instead of focusing on job creation or retirement security or fair taxes, we're debating repealing a law that protects Americans from insurance company abuses, provides fairer and more accessible health reform for children, for veterans, for seniors, for employees, for employers. The law saves the average taxpayer money, and it saves the insured money. On Monday, we celebrated Dr. Martin Luther King Jr. Day. Dr. King fought for an America where everyone, regardless of race or class background, had access to the American opportunity. He said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." Today, the new majority is trying to repeal the health reform law that we enacted just 1 year ago. That historic law provides secure health insurance coverage to almost all Americans and lowers the deficit. The days of "you're on your own" are past now. The law ensures that health insurance companies actually have to provide health insurance. Not just in name, but it requires that they spend your premium dollars on actually providing health care. If this reform law were repealed, Anna's 24-year-old son in Kendall Park, New Jersey would become uninsured. Todd from Eatontown would not be able to get insurance due to his pre-existing condition. Thousands of seniors on Medicare, like Howard from Monroe, would not be able to afford his life-saving prescriptions. Matthew from West Windsor wrote me to say, "I just graduated from college. I'm working on a job with no health care." He's grateful now that he can be on his parents' health insurance plan, but he's concerned if this is repealed. He says, "I have a pre-existing condition, and shockingly, I truly would be without insurance and in big trouble if this law were reversed." I urge my colleagues to vote no on repealing the health care reform law.
Gentleman from Minnesota is recognized.
Thank you, Mr. Speaker. I'm very pleased now to